Hello, my name is Natasha and I am the Senior Programme Manager at the UK Health Show 2018. I'm here today with Dr Marc Rowland, who is the Chair of the London Clinical Commissioning Council and also Chair here at NHS Lewisham CCG, where we are today. So thank you, Marc, for taking the time to join us this morning, on a sunny Friday morning.
Lovely.
Thankfully. So if we could just start off by talking about London devolution. So at the end of last year, it was announced that London will become one of the newer regions to become devolved. Obviously to localise decision making, to in turn benefit health and social care integration. What impact do you think this will have on London and the population that it serves?
Well, we're hoping very much that it will bring the delivery of healthcare much more down to the personal level, the people level. Because I've now been, I say, a GP for an awful long time, and I've really enjoyed the fact that I work every week in the practice, and at that time I'm talking at the level of one-to-one with the patient. I walk out of the practice, out of the door to my practice, and I'm talking 1 to, 14,500. I then talk to my neighbourhood, it's 1 to 60,000. I then CCG's 1 to, 285,000, and then STB 1 to 1.7 million. So,
wow.
so that all these different levels, and it's so important that we start delivering care at the level that it's needed. So the main emphasis is going to be on the localities, or that we call them neighbourhoods in Lewisham, and working at the neighbourhood level. But also then we need to get the STPs covering so that they can work at the level of larger hospitals and the larger flows that occur across those levels. But London itself is unique. I know the rest of the country is never happy when we say London is different, but London has many differences and the complexities, and we are able to help those much more through the devolution. We've had 5 pilots going, looking at different aspects of where we can either deregulate or change parts of the way that we work, and obviously it's very important in London also on the estates work, which I know
Absolutely.
Sir Robert Naylor is talking in another session, which I think will be extremely interesting. I hope I'm able to see that with him. So we are really excited. It's a different pathway to Manchester. In London we've had the CCGs have been working very closely together for a long time. As you said, in fact the London Clinical Commissioning Council is the grouping of the chairs together there. And the councils now are also starting to work, and over my 5 years in this work we brought together the local authorities with the Mayor, NHS England, NHSI and the clinicians. At the moment that's represented through the CCGs, and we're hoping to move on to other ways of making that work for London.
Oh,
so sorry, I can go on forever about
it.
it.
That's
really
great.
Exciting.
Well, that takes me nicely into one of my next questions, which, with so many different parties involved in making this a success, how do you go about balancing and aligning the priorities of different individual parties whilst making sure that the public remains engaged and making sure that their needs are met?
It is difficult, and I think, to be honest, we need to work more on that in the future. We've got the London Health Board, and I'm very pleased that Sadiq, the Mayor, is really very involved now in health work. Obviously he only has a limited official responsibility for health, but he is very involved and he's got a very good team working around him. And also with the amalgamation of NHSE and NHSI, that will simplify matters. But the Mayor himself is looking at how we can get more public involvement, and I think that is an area that we needed to get this started, and all the way through we've been looking at trying to get more public involvement, like we do. I mean, the CCG we have large practices now, we have the patient participation groups working really effectively, and again, as I was saying at the beginning, we need to get that layered up to try and get more input and represent the democratic mandate effectively in healthcare.
Okay, great. So you'll be speaking at the show to take part in a panel discussion looking at the opportunities and challenges for integration for devolved regions. What do you think is the biggest opportunity, and what do you think will be the biggest challenge moving forwards?
It's going to be the integration, and as I said, it's going to depend on the levels, but across London we need to look at what works for the population of London. We're really very lucky to have such fantastic hospitals. But a lot of those hospitals are also, the big FTs, etc., are orientated nationally and even internationally in some cases. And we need to learn how to get their more DGH functions working effectively with the It'll be the CCGs mainly around them, but obviously STPs as well, and to make that work. And that I think will be quite a learning we have to do. In other areas, like I'm lucky, I've got Lewisham and Greenwich Trust, so we're only dealing technically across 2 CCGs, and you've others like Hillingdon that's only really got 1. And I think we may be models of how we can make it work at a DGH level, but I will be really interested to see how we can work with the FTs.
Oh, brilliant. So there's a big project ahead and a lot to see.
Yes.
So in the year that the NHS is now celebrating its 70th birthday, what would you say then needs to happen to ensure that for the next 70 plus years the NHS can continue to deliver that great level of care that it's so known for?
I think we need to have a big rethink, and as you were saying before, very much involving the public. I don't think the public are quite there. People tend to think that the healthcare will be there and there should be as much healthcare as everyone needs immediately delivered, and I would love to be able to do that. But we all know that with an ageing population, with the complexity of care that's coming, the amount of things we can do that are so brilliant that we couldn't do at the inception of the health service, we have to have a debate about what can be done. And I think we also have to ask the public, a bit like the American presidential quote, what can the public do for healthcare as much as the healthcare can do for the public? There are some brilliant schemes around the country, obviously the Altogether Better one, because that's one we're interested in, where you actually, even at the practice level, you're asking people what can they offer the practice. And there are many really lovely stories of people that were actually very demanding of healthcare, and probably not needing an awful lot medically, but maybe a bit lonely, a bit unhappy in other ways. When they have a role and feel they are useful, they can get on and deliver a huge amount. So
Absolutely.
I would love that, and I think we need to again take that up all levels to say, what can we realistically deliver, because everyone is so proud of the NHS and the 70 years, and the last thing anyone wants is to lose it. But I'm afraid if we just carry on exactly as we are, without the integration with social care, health care, and more with the population, we could end up losing it by default, and not going down the pathway.
It's a scary thought.
Very scary, exactly. I'm getting old. I'm going to need it at some stage. I know, so I'm very scared of that. Yeah,
no, absolutely, and as well for me. By the time I get to that age, I really hope that there's an NHS there waiting.
We must keep it going. Yeah, absolutely. Yeah.
So my final question just leads us back to the show. And what are you most looking forward to about the UK Health Show 2018 this year?
I think the show is fantastic, and the people that are coming. You've mentioned Robert Maynard and other people. I've seen. I don't know all the people that are coming, but very interesting. Looking around the country and allowing us to compare and contrast and be excited by and jealous of and think, what the hell are they doing, and so on, or they can't be doing that, they're lying through their teeth. But I think all these opportunities are great, and again, if you look around the stalls and the stands, I normally find something that I didn't know was happening that's capable, and I frequently would wish to follow up on some of that. Great. So I'll be very interested to see what we have there and listen to some of the speakers.
Absolutely. Well, we'll definitely have a lot on offer, especially from not just the content side, but also from the supplier side. We've got some great companies on board as well already. So
lovely.
Look forward to seeing you there and delving deeper into these topics at the show.
It's very interesting.
Well, thank you very much.
It's a pleasure. Thank you very much.
You're welcome. So make sure you join us on the 25th and the 26th of September this year as we expand to 2 days to hear Dr. Marc Rowland and so many other speakers in action. And don't forget to follow us on Twitter at the UK Health Show, and don't forget to hashtag us at #UK Health Show 18. We look forward to seeing you there.